Hi, my name is Ryan. I'm a student at Nightingale College, and welcome to my prenatal care education series. In this video, I'll cover important aspects of your pregnancy journey, including the frequency and purpose of prenatal appointments, essential diagnostic tests, proper nutrition, safe exercise, appropriate weight gain, and common pregnancy complaints, and critical warning signs. Let's get started. First of all, here's my badge. Regular prenatal care is vital for monitoring your health and your baby's development. Here's how often you'll need to see your healthcare provider. Every 4 to 8 weeks will be monthly visits, and weeks 28 through 36 will be bi-weekly visits. Weeks 36 through your birth will be weekly visits. During these appointments, your provider will monitor your blood pressure and weight, check your baby's heart rate, measure the size of your uterus, discuss symptoms or discomfort, provide education on what to expect during the coming weeks. They'll also do different diagnostic procedures and labs, and some of those will be during your initial visit. There will be a comprehensive blood test to check blood type, your Rh factor, to see if you're anemic, to check for infections, and check for immunity to rubella. They'll go through a full health screen and your history, questions about previous pregnancies. They'll do urine tests for proteins, for glucose, and for signs of infection as well. During your first trimester, you'll get an ultrasound during weeks 8 through 12. That'll confirm your pregnancy and also let you know what the due date is. You'll also get a chorionic villus sampling, also called CVS, and that's weeks 10 through 13. It's optional and it checks for genetic testing. Your second trimester is weeks 15 through 20, and you'll be screened for Down syndrome and trisomy 18 and neural tube deficits. You also get your anatomy scan, which is what everybody's most excited for. That's when you get your little 3D printout. That's weeks 8 through 22. I don't remember if I said that. That's the little 3D picture that you can take home, show your friends and family. You also get a glucose tolerance test weeks 24 through 28. And this screens for gestational diabetes. Your third trimester is your Group B strep and Group B strep screening. That's week 35 through 37. You also get a non-stress test, which will monitor the baby's heart rate. And lastly, they'll do a biophysical profile, which combines the ultrasound with the non-stress for a full comprehensive assessment on the baby. Balanced diet is crucial for a healthy pregnancy, and you want to include fruits and vegetables and aim for 5 servings a day. You want whole grains, so whole wheat bread, brown rice, and oatmeal are good to eat. Your proteins, you want lean meats, poultry, fish, beans, and nuts. Dairy, milk, yogurt, and cheese they're all great for calcium. You're going to be on multivitamins and supplements. The most important one is folic acid. You want 400 to 600 micrograms daily, and this helps to prevent neural tube defects. Iron will help prevent anemia, and that's available in many of the prenatal vitamins. Calcium, you want 1,000 milligrams. That's for bone development for you and for baby. And you want to take vitamin D to help with the absorption of the calcium. Staying active is beneficial for most pregnant women and everybody. Some guidelines for safe exercises are walking. It's good cardiovascular and it's low impact. Swimming is good on the easy on the joints, and it's also low impact. It's a full body workout. Prenatal yoga is great. It enhances flexibility and provides relaxation techniques. Stationary cycling is great cardiovascular exercise, and it's very low impact, and there's no risk of falling off as you would from cycling, riding your bike down the street or something. Exercise to avoid: contact sports, obviously, no soccer, basketball, or tackle football or anything. Other high-risk activities like skiing, horseback riding, or scuba diving. And you want to avoid heavy impact stuff like heavy weightlifting because it's very strenuous on the body. You want to aim for at least 150 minutes of moderate intensity exercise per week, spread out over several days. Weight gain recommendations can vary based on your pregnancy and your BMI. So underweight is considered BMI under 18, and you want to gain 28 to 40 pounds. Normal weight is BMI 18.5 to 25, and you want to gain 25 to 35 pounds. Overweight is 25 to 30 BMI, and your goal for that is gaining 15 to 25 pounds. And obese would be anything considered over 30 BMI, and for that the goal is 11 to 20 pounds of weight gain. Pregnancy can also come with discomforts. Some of the most common complaints would be nausea, vomiting. For that, you want to eat small, frequent meals, avoid strong odors. Ginger supplements can be helpful, and you want to stay very hydrated. Heartburn is another common symptom that you can experience during pregnancy. So eating smaller, more frequent meals is helpful. Avoiding spicy or high fatty foods. You also want to try and elevate your head while sleeping, and use antacids if your OBGYN prescribes them. Back pain is also very common, so maintaining good posture, using a support belt, and performing stretching is good for that. That's why yoga is so helpful for exercise. And also you can use heat packs on your lower back and abdomen. It's crucial to know when to call your provider if something's going wrong. Some reasons to reach out would be severe abdominal pain or cramping. It could be a sign of preterm labor, placental abruption, or other serious conditions. Severe headache or vision changes could be signs of preeclampsia, which is characterized by high blood pressure during pregnancy, and that can result in organ damage. Vaginal bleeding is also something to look out for. It could signal a miscarriage, placenta previa, or placenta abruption. If you have any of these symptoms, please seek medical attention immediately. Thank you for watching my prenatal care guide. Congratulations, take care, and be safe.